HIV self-test, it's quite similar to an HIV rapid diagnostic test, but it's packaged as a kit with instructions, and it's really designed so that somebody can do it on themselves. Some of them still rely on a finger prick blood, so you would prick yourself the same way that people can measure their own glucose at home. Others actually don't require you to break skin, and instead you can swab the gums because something very cool is it turns out that it's not your spit, it's not the saliva that comes out of your salivary glands from under the tongue, but actually this other liquid in your mouth that kind of percolates through your gums up here that also has the same antibodies that the liquid around your blood cells have. So if you swab your gums, you can also use that to run a test. And some people remember Barack Obama doing one of these tests on camera. So both of these are available. The main difference, honestly, is the self-test. It costs a little bit more because they really had to test it to make sure that it's going to work in the hands of someone who is not trained. And it has to come with instructions and sort of come as a self-contained kit, as opposed to a baggie of, 1,000 test strips. And so where the lowest cost that I've seen for a rapid test done by a provider might be 75 cents. One of these rapid tests, the lowest cost that I've seen is a little bit more than a US dollar. So it's still very affordable. Here in the United States, where I'm calling you from, it's a whole lot more. I think if I walked into a pharmacy, I would pay $40 for a rapid test. But for countries that are being smart and procuring these ahead of time and in volume, or maybe even pooling their procurement, you can get these to be quite low cost. In the United States, you can get a self-test if you have money. And some institutions have made efforts to get self-tests to particular populations. Some universities have even had self-test vending machines for their campus populations, but it really varies depending on where you are. It's sort of up to your local health department to decide whether subsidizing self-tests is a priority. Otherwise, it's between you and CVS or Walgreens and whether you have the $40 to buy the thing. In low and middle income countries, we all know 2/3 of people with HIV are in the sub-Saharan African region. And there, a lot of self-testing is happening actually through the public sector. So governments are really seeing this as a tool for HIV control. And they're really starting to invest in buying these tests, again, with bulk procurement in advance so they can negotiate the best possible prices that they can. And so what we're seeing now is that governments are starting to distribute substantial numbers of these HIV self-tests to clinics using various ideas that they have about where they may most be needed. So clearly there are populations that have much higher risk of HIV where these tests could be distributed as part of a social network testing strategy. People who come into clinic and are diagnosed positive are often given a self-test to take to their partner. Uh, Sometimes, actually, after all of the disruptions that happened from the beginning of 2025, having that supply of self-tests has really helped countries because supply chains for ordinary rapid tests got very crazy. PEPFAR, had lots of these self-tests that they were supposed to ship to countries that they didn't ship. And suddenly these 75-cent tests that are really the start of care for people were stocking out. And so at that point, the WHO said it's perfectly fine to take these self-tests and use them just to backfill stockouts of regular tests. Now, in the current context, where money is very tight and staff is very tight, we have to remember, USAID employed some frontline workers who were there testing, providing care, or doing other important clinical or kind of managerial roles. Self-test, I think maybe one of the most important roles that they could have is just reducing the number of staff that you need to operate HIV care, because staff who do testing most of their time is spent testing and counseling people who are ultimately HIV negative. And if they're working with a population that most people may not need prevention services, may not need PrEP, or maybe they could be referred to services that the general population should consider, like circumcision or voluntary male medical circumcision, to be very clear. The kind of magic thing that the self-test can do is triage the negatives. So if it can be the patient self-testing on their own in the waiting room, and then you have the positives come in to see the provider. Now the provider is not in a rush and they can really take the time they need to counsel that person and make sure that they link to treatment.